The mistake that I see so many nurse educator colleagues making in academia is thinking that our curriculum has to be perfect. We know that there's many iterations, there's revisions that happen to our curriculum based on feedback. Welcome back, everybody, to Dr. Sellars Educate, where our mission is simple. It is to support all nurse educator colleagues, all of our nurse leaders on the journey to achieve excellence. So if you are here for the first time, welcome. We are delighted that you are here. And if you're returning, welcome back. Make sure you go ahead and subscribe to this channel. And then the second step we want you to take is to pull out your study worksheet. Every time you show up for a snapshot, we want you to have your worksheet in front of you, or at least a sheet of paper to write down, number one, what is today's date? Because if you're like me, you are watching a lot of different webinars, and we want you to remember today's date, okay? And number two, what is the objective that you want to walk away with? Knowing that we're going to explore some of the key strategies to help ensure that we are integrating evidence-based practices as we review our curriculum and make revisions. All right, so let's go ahead and take a look at our content for our discussion today. You should be able to see my screen. We're going to use Canva for our conversation as we explore community, curriculum, and competency. We're talking about what is that pathway that we should take? What are those steps to integrate core competencies in nursing education? We know those core competencies really describe what those behaviors should look like whenever students are providing patient care. We also know that with Patricia Benner's work, Novice to Expert, and bridging that theory practice gap is critical to help our students advance their skills, as well as be able to scaffold their learning in our classroom. There are 3 learning domains, and if you have Billings and Halstead's 6th edition in front of you, you're going to turn to pages 188 through 190. This is going to give you a deep review of those 3 learning domains so you understand the lowest level of learning as well as the highest form of learning for each of those 3 learning domains. So you may be wondering, okay, what does this have to do with curriculum? Well, it's all about learning when we think about how we not only build our individual course, but as we spread our courses and align our courses across the actual continuum of learning semester to semester for our students. So let me ask you this question. What one word comes to mind when I say the word curriculum? Maybe it's testing, maybe it's standards. We know that when it comes to accreditation, each of the agencies have their own standards that is going to help guide us to validate that we are indeed alignment with integrating evidence-based practices into our curriculum. But the reality is we don't want to wait until our accrediting body validates that for us. We want to go to our primary sources, which are going to be Billings and Halstead. And then that second resource is going to be maybe your guidelines from your accrediting body. It could even be guidelines from your board of nursing, okay? But you want to look at standards that are going to help guide you in making those decisions about your curriculum. Maybe you think about programmatic outcomes. As I mentioned earlier, when we're creating our mapping documents for our program, we want to make sure we're mapping across all the different phases of the learning journey, okay? So we have to think about what are those outcomes that I expect my learner to have when they walk away from my class today. Okay, so think about outcomes as what is it that I want my learner to achieve as a result of spending time with me. Learning objectives are more broad, right? We know that when it comes to a course, we have specific learning objectives, and we want to make sure there's alignment with those learning outcomes as we plan our students' learning experience across our course. Maybe consistency comes to mind, leveling, scaffolding. Those are all great examples that colleagues have previously shared with us using this word cloud strategy to really describe what comes to mind. Okay, so I want you to think about what bubbles up for you. What is one word that you think about? And then I want you to go a little deeper as we explore our conversation today. You're going to have some homework because we're specifically talking about action. Okay, your ability to achieve that passing score on the C&E exam is related to your ability to truly apply and analyze. So we may understand that we have to have, as an example, learning outcomes for our courses, but maybe we're not sure exactly how that aligns with a teaching strategy. Billings and Halstead is going to be your primary source to help you have a deeper understanding of exactly what that means. The other resources we talk about standards is with these hallmarks of excellence. Now, this is from NLN. You can see that this is their model. They have outlined specifically what are those key components, those key categories associated with having this high level of excellence within our nursing program. And you can see here that innovative evidence-based curriculum is one of the key elements. We want to think about specifically what are our patient care needs and how does my content in my course show up to help the students have a deeper understanding of that specific concept. So when they're at the bedside taking care of that patient, they are competent and confident in the care that they are delivering. So those are some of the elements we want to consider, and you can always do a search to find that model to go deeper. Now let's take a little bit of time to talk about the competency associated with curriculum. So it specifically says nurse educators are responsible for formulating program outcomes and designing curriculum that reflect contemporary healthcare trends and prepare our graduates to function effectively in the healthcare environment. You're going to have a deeper understanding of this concept around curriculum and what it all means by just taking a look at pages 118 through 131. That's going to give you a really good introduction. And if you want to go a little bit deeper, if you happen to have Patricia Benner's Educating Nurses book on your bookshelf, then that's also a really good resource. As you walk through these competencies, I want you to think about what behaviors do I demonstrate in my work every day to align with the actual behaviors that are described in the actual competency. When you get to the CNE exam, know that the number one step in helping you achieve success is proper preparation. Okay. And so this is why it's so important for you to go to your primary source, which we call Billings and Halstead, our Bible in nursing education. That's the primary source that we want you to go to have that deeper understanding of concept. And then when you think about writing your learning objectives, as we said, you also want to think about your learning outcomes. And we just have one for today, where we want you to think about evaluation. So this is what we want one of your takeaways to be, or at least consider it. You may have written down a different one already. We want you to evaluate your current curricular activities, and we want you to propose at least one improvement or addition that aligns with the NLN nurse educator competencies to enhance learning outcomes in your educational setting. Okay, so how do you do that? Just pick a course. Just pick one course that you teach. I want you to take a look at that learning objective as well as the learning outcome, and then look at what activities, what teaching strategies are you using to really help your learner connect with the content, because that's what our teaching strategies are all about. How can we better engage and connect our learner with the concepts so that they're able to make safe patient care decisions? We want to also think about how can we unlock, how can we truly connect our curricular elements in our course with the behaviors that we expect our students to demonstrate. Want to think about, as an example, the importance of community, having a collective group that is going to support our students on their journey to achieve competency. We also want to think about the design. How are we setting our students up for success? How are we sequencing our courses? How are we integrating key concepts into our courses week by week? Are we scaffolding their knowledge to validate we have that solid foundation before we start to introduce some of those more complex concepts? As an example, if students don't understand blood flow through the heart, then they may struggle with understanding what actually happens when a patient has a heart attack or an MI, right? So that's what we want to think about. And the last point is enhancing competency-based learning. We're bringing clinical experiences into our classroom. This is how we take a critical step forward in bridging that theory practice gap that Patricia Benner talks about. And then the other element, of course, is we are supporting students' learning by engaging with them repeatedly, right? Engaging in iterative practice. So students have chances to demonstrate a skill, to get feedback from us, make corrections, and do it again, right? And the goal is that they improve the next time. So here's a question I want you to consider. How can core competencies enhance nursing education in your learning community? Okay, so I've talked about a few examples, specifically bringing resources, those clinical resources, to have those hands-on experiences with our students in the classroom. Good example is going to be a Foley insertion kit. There are many examples that you can think of that students are going to have experiences, maybe even in the skills lab or sim lab, that we could introduce some element of that in the classroom. Now, I know we often think about unfolding case studies, and those are great too. Just remember that our ability to engage students with those unfolding case studies is going to start ideally with them thinking about those clinical experiences they're having. Let's leverage their experience in the classroom so that we're not always feeding them those case studies. They can absolutely come up with some examples that they've seen firsthand. We just need to guide them, give them a framework, give them some instructions, some support, and they can come up with some really good case studies. The next question I want you to consider is, do you think our students struggle with reading? Okay, maybe it's just my graduate level students sometimes, but I know even if I record that Loom welcome video for the week, I often reflect on the previous week, especially if they struggled in a certain area. And I also focus on what we're focusing on or what we're going to learn in the upcoming week. Okay, so that's what I'm using right now. I decided to use the Loom opportunity or the Loom technology to share our information today. So that's what you want to think about. How can I truly help my students, first of all, develop that solid foundation of knowledge? Many of our students are going to be those auditory learners, and we want to make sure that they are engaged in validating their knowledge, asking the right questions, and then we want to clarify their muddy points before we get into more complex clinical situations. Our ability to integrate competencies into the curriculum starts with our students understanding how to read our textbooks. Okay, so just think about what strategies we can use to help our students understand how to read a nursing textbook, because we know that they cannot read 1,000 pages, right? So we have to think about how can we help them study? How can we help them understand the process that they need to follow to read a nursing textbook, because it is different. And then the next consideration I want you to think about is related to this thought-provoking question. So see what you think. And remember, the most important part is that you understand the rationale for the correct and incorrect answer. Considering the NLN nurse educator competencies, which strategy best demonstrates an advanced application of these competencies in nursing curriculum development? Okay, so we took a look at the actual competency as part of our conversation today. If you need to go back and reflect and look at that competency, take a deeper dive, remember that it's on the NLN website. If you go to the credentialing tab from the home page, then it will open up to the nurse educator exams, okay, the certified nurse educator exams. And then when you click that one, you can choose C and E. The handbook is where you're going to find those details about exactly what competency 4, which is curriculum for C and E, is all about. So A, systematically reviewing the curriculum annually to ensure it includes current evidence-based practices and aligns with the latest NLN competencies. B, implementing a standardized test across all courses to uniformly measure student knowledge and competency in relation to NLN standards. C, designing a series of interdisciplinary projects that require students to collaborate with various healthcare professionals, thereby fostering a real-world application of community and competency. All right, so you can think about, what is this question really asking me? Number one. Number two, what is it that I know for sure about content in this question? Another takeaway I want you to consider related to our earlier conversation is related to how we can use these competencies, these core competencies, as a foundation with our students. How can we integrate more application experiences so that they can advance their knowledge and provide safe patient care consistently? So this is an objective you can consider to answer this question. You're going to be able to demonstrate a community building process by developing a brief action plan that incorporates at least 2 strategies to foster this supportive learning community that we talked about. All right, so that's one example of a strategy that you can use. If you chose C, congratulations, designing a series of interdisciplinary projects is the correct answer. Now let's talk about why. So when you take a look at this specific answer and looking at NLN nurse educator competencies, we know that this option reflects a deep integration of NLN competencies by promoting not just knowledge and skills, but also collaboration and real-world application. And we know this is crucial to help prepare our students for that complex care that they are going to have to provide at the bedside. All right, so hopefully as you reflected on that thought-provoking question, thinking about what your homework's going to be, looking at just one opportunity and one course for you to improve and create a richer learning experience for your student. So maybe you thought about some of these opportunities when we talk about integrating changes into our curriculum. Maybe there's an opportunity for more community involvement. We know we serve the community, We don't want to just look for community experiences in our population health or community health course. So how can we do that? We want to think about the scenarios that we're talking about in our classrooms. We want to think about how can we better partner with our healthcare organizations to truly talk about the needs of our community. Oftentimes in our program, students do a community needs assessment or windshield survey. How can we thread some of that information we gather from that survey across our curriculum? And second, how can we make our curriculum even richer so that students understand not only the value of evidence based practice, but also the rationale? It's important to follow sterile technique because we want to decrease hospital acquired infections, as an example. When our community has a lot of hospital acquired infections, they start to not trust the healthcare system, right? So it can have a long term impact. And then next is competency development. So, what's missing in the curriculum? There's often blind spots, and they can frequently happen when we're the only faculty member that's teaching a course. So maybe there's an opportunity for peer evaluation so that we can have a deeper understanding of some of those opportunities to enrich in our curriculum, make those richer learning experiences for our students so they can provide safer patient care. If you want to go a little bit deeper, take a look at Billings and Halstead. Again, this is the 6th edition, page 185, where it talks specifically about learning experiences, both structured and unstructured, because they are both important. Well, thank you all so much for joining us during this snapshot. We hope that this information has been helpful as you explore opportunities to improve your curriculum, create better learning experiences for your students, and ultimately provide safer care to our community, and we know that they deserve it. So what's next for you? If you're ready to commit and finally get C&E off of your bucket list, it took me almost 8 years. Good thing is you can get it done in 60 days. We continue to have a 98 to 100% success rate when colleagues follow our 7-week study plan that's included in our C&E in 60 days. You can find the link right here in the description, or you can head over to our website, drsellarseducate.com. We look forward to seeing you in the next snapshot. Take care, everybody.